there, Myo friend, and welcome back to this episode of the Myo Minute. I am Carmen Woodland. I am your host. I'm an orofacial myofunctional therapist, and I have a large online global practice, so I bring this important therapy to everybody around the world. So I absolutely love what I do. So in this episode, I'm going to be talking about tongue ties. They are not about appearance. So I always say that if I had $100 for every person who sent me an email saying, hey, does this look like a tongue tie? You guys, I would not be here because I would be sipping Mai Tais in a glass bottom hut in Tahiti. Okay, so that means I get a lot of emails about this. So I'm gonna talk about that. So what do I mean by it's not about appearance, it's more about function. So yes, some of you guys may have or know somebody who has what I consider low-hanging fruit. That's obvious. That's that obvious restriction. That's an obvious tongue tie. But I would say for a majority of my practice, these people do not just outwardly show that they have a tongue tie. And so we look at the symptoms. So that's the biggest thing. Many people will do the whole, open your mouth as wide as you can. So that's the maximum. And then raise your tongue to the bump behind your top front teeth, which is the incisive papilla, which is the spot. So that's the resting position for the tip of the tongue. So when we look at those two measurements, so for me, you can tell I have 100% range of motion because I don't change the position of my mouth to touch. Okay. And so a lot of people will email me and say, hey, Carm, when are you going to get your tongue tie taken care of? And I always say, I have 100% range of motion. I do not have a tongue tie. I have a lingual frenum, which everybody does, but I do not have a tongue tie. So yes, that range of motion comparison is important. And in fact, more important than that is the suction. When you suction up, to see how far open you can get. So many of my tongue-tied clients can only do like this much. And so that's what we're looking at. So not so much anymore this versus this, but the suction versus, what their max opening is. So we look at that. Now, so I'm going to talk about the symptoms. So it's not about the appearance. It's about the symptoms, the impairment snapshot. So that's all of the symptoms that support, hey, I have this problem. So how does your doctor diagnose that you have a stomach ulcer? They don't just scan you or look at a picture of you and say, that's it. It's generally in medicine, they start with looking at your symptoms. So the same thing here in my practice, but then we also look at a functional assessment. So everybody who has an exam with me, I put you through several movements so we can see how the muscles work. I use that information to plan your therapy. So it's very, very important. Okay, so I'm quickly just going to talk about the areas that I look at in an exam that helps uncover those symptoms. So we look at symptoms all the way back to when you were an infant. Did you spit up a lot? Were you gassy, fussy? Were you labeled colicky? Did you have to be propped up in your crib? Did you have a lot of ear infections? That kind of stuff. Did you just flat out have trouble latching? Also, did you have a release as an infant? That's a biggie. Then we look at breathing and airway concerns. I work with somebody on 4 goals of therapy: tongue posture, mouth posture, nasal breathing, and correcting and normalizing the swallow. So I need to know how you're breathing. I need to make sure that you don't have any plumbing issues here in the nose, or else we need somebody else on our team to help that. We look at oral resting posture. Where are you at right now? Are you able to get the tongue to the roof of the mouth? If not, why not? Is it because of a restriction? Okay. We look at digestive complaints, eating behaviors, chewing and swallowing. Have you had a previous tongue tie diagnosis or a previous frenectomy? Did you do myofunctional therapy? I meet hundreds and hundreds of people every year who had a release done, but because they did not do the adequate pre and post procedure, it was not successful. And so the comparison that I make for a lot of people is this: Do you know somebody who had a hip replacement or a knee replacement who sat in the recliner up until their surgery, had the surgery, and sat in the recliner afterwards? Those people are miserable. I know specifically people who have had to be put back to sleep and to go into surgery to get those muscles to work because it's so excruciatingly painful. Does not sound lovely. So that just means if you don't do the work, the rehab work, the success of your frenectomy is going to be extremely low. Whether you know it or not, whether you disagree with me or not, that's just the facts that I see in my practice. Do you have toxic oral habits? What about dental and orthodontic history? I am seeing clients who are in their 60s and 70s that are getting braces for the 6th time. No joke. Okay, there's a reason. Behavior issues, speech therapy history, head and neck tension. Is there an issue with the facial development? Jaw issues, sleep issues, mental health issues. So those are all things that help me look at whether somebody has a tongue tie, okay? Also, we look at something, so the insertion point of the frenum underneath the tongue looks at the free tongue, so that's this outer portion, and then it looks at where it inserts in the mouth. How does it attach to the floor of the mouth? Does it attach to the bony ridge? Where does it insert here on the tongue? But honestly, you guys, most of my clients, their attachment may look normal, but if this attachment right here in the middle of the tongue, if it's too short, if it's too thick, if it's too tight, we use a little bit of common sense. If it just looks like you can't lift the back of the tongue, then it's going to be impossible to get correct tongue posture. It's going to be impossible to correctly swallow. So there you have it. That helps explain why when you send me a picture that I tell you we need to do an exam so I can know more about your impairment symptoms, and then we can kind of build that picture from there. So if I'm speaking to you and you found yourself nodding your head, then my friend, it's time to get an exam. So that we can get you headed in the right direction. So we look at all of these things during an exam, you do a functional assessment, and then we go from there. I help you build your travel itinerary. So wherever you're watching this video, you will find a way to get your exam scheduled. And I will ask you this, if you know somebody else who needs to hear this, make sure that you share it with them, because that's how you and I are going to make an impact on somebody else's health. So I will be back next time with another hot topic. Bye for now.